going to call this work session on a general conversation on face coverings to order. Let's start with introductions.
Steve Peterson.
Felix Rivera. And we have Austin Quinn Davidson. She's just not in the room right now. On the phone for Assembly members, Crystal Kennedy.
Here.
Suzanne France.
Here.
Forrest Dunbar.
Here.
Jamie Allard.
Here.
John Weddleton.
Here.
Great. So for folks on the phone, Assembly members, feel free to text me to get into the queue. I'm going to go ahead and turn it over to Mr. Dunbar and Ms. Zolotel to lay the foundation for this work session.
Oh, I'm sorry. Did you start?
Go ahead, Forrest.
I'm sorry, Mr. Chair. Did you mention me?
Yes, I did.
I'm sorry, there was some interference on the line there briefly on my end. Yeah, I just want to thank everybody for being here. Obviously, Ms. Zolotel and I have put forward a resolution twice now calling on an expansion of the face covering mandate for employees at critical businesses around town. And this, during our last debate, several members, including, I believe, Mr. Perez-Padilla, asked for more information and a work session to help them make a decision. And so we have, I mean, the bias of myself and Ms. Zolotel is pretty clear. Like we're not hiding the fact that we still want a mask mandate. I think there is evidence that the Assembly should consider that has come to light even since our last debate on this topic. Today, during his community briefing, the mayor mentioned that a mask mandate is on the table, and perhaps will be even broader than just employees, although he didn't specify. But today we had 26 cases of COVID-19 in Alaska. Our numbers, our averages continue to be the highest they've been since the early days of the outbreak. And so today we have several doctors who have asked to speak, and we've also asked a couple of state house legislators to hopefully present too on the effort or perhaps lack of effort on behalf of the state vis-a-vis face coverings. Thank you, Mr. Chair.
So I have the list of individuals who are joining us on the phone. And so what I thought we'd do is I just kick it off by introducing or saying each one of your names. And then circling back and just asking you to speak, with whatever you have prepared, and being ready for hopefully some questions from the members. So today we have with us Dr. Helen Adams, Dr. Megan Ritter, Dr. Monique Childs, Representative Darren Farr, and Representative Zach Fields. And I'm going to ask if Dr. Ritter, if you're on the phone, if you could kick us off with some information.
Sure. Can everyone hear me okay?
Yes, we can.
Excellent. Okay. I am a pathologist by training, so pretty much we study disease. We do all of the laboratory testing, the biopsies, the autopsies on patients, and we figure out the cause of disease, and that's pretty much where our training lies. I'm currently medical director at the blood bank, as well as teaching at the Zambia School of Medicine here in Alaska. And it was concerning in the observations of the community that once the lockdown or the hunker-down order was rescinded and the businesses started opening again, that there was not compliance or adherence to the recommendations by the international, the national, and even the state societies with regards to mitigation efforts to prevent and limit the transmission of COVID-19. And as we've seen since the openings, we've had a pretty significant increase in cases as would be expected. And so what I tried to do is a colleague and I, Dr. Sarah Murphy, got together and we drafted a letter that we wanted to try to convince the governor to consider masking, because the evidence and now is even increased and become more apparent since our letter that we had sent out, that facial covering is one of the essential mitigation efforts necessary to stop this pandemic, and it's been demonstrated in multiple hotspots as well as different countries, so internationally and nationally. There's now articles that have been coming out, multiple medical journals, indicating that if we could get masking of everyone, so not just employees, but also of the public in any indoor setting where social distancing is not easily occurring, that we could limit this reproductive number, the R naught of the viral transmission to below 1, so that we would be able to limit the transmission, have much fewer cases, and really look at being able to open up our economy in a healthier manner. I'm happy to take any questions, but what I can say is what we know so far about this virus is that it's easily transmitted on a respiratory droplet, which just means that the viral particle is on a little fluid droplet, and that fluid droplet is definitely trapped by mask material. Sure, if it were just the viral RNA floating around, yes, that can get through the mask material, but the vast majority of the RNA or the viral material is on a carrier fluid droplet, and that is trapped in these cloth materials that we're all wearing. We wear masks in surgery to prevent other people from getting sick. We wear masks if you go to the doctor's office and you have cold symptoms to prevent other people from getting sick. So we wear masks to prevent those respiratory droplets from spreading to other people in public places. The virus is infectious based on like a load, the amount of virus you're exposed to. So if you're exposed to very little amount, your immune system may be able to control it. If you're exposed to large amounts, then it does seem to correlate with a greater incidence of disease. And so if you even are spreading a little bit around the mask, you're still mitigating that transmission of that virus and having a strong effect on the community spread, which is what we're trying to prevent. So we believe, and now we have over 230 healthcare workers in the state, majority of which are physicians that have signed on to this letter to recommend the use of masks by everyone, employees and the public, anytime they're in indoor spaces, to try to get a handle on this pandemic and allow people to safely get back out into the economy and open our state back up without increasing hospitalizations and sickness.
Great. Thank you, Dr. Ritter. I don't feel like we do have any questions coming through the queue. No, none right now. Okay. I also wanted to note that we have Natasha Pineda with the health department online, as well as Bruce. I don't know Bruce's last name. I apologize.
Oh, Chandler. Dr. Chandler.
Thank you. Dr. Chandler. Oh, someone gave me his first name. I'm sorry, Dr. Chandler. I apologize. We're going to keep going through our speakers and then have the health department weigh in if they would like as well. Dr. Monique Childs, are you on the line?
I am online.
Okay, would you like to add anything to Dr. Ritter's comments?
I think I would like to endorse what Dr. Ritter said and really be clear that the science around mask wearing is pretty indicative that it is helpful. There's very little doubt that it does minimize transmission and exposure. And we really look to our leaders on the Assembly to make a decision for the community. Because without a policy that requires mask wearing for everyone, there'll be confusion about what is okay. Even if you look at the conversations that are happening in places like social media and even on the news, there's misrepresentation of what we're looking for, and perfection can then become the enemy of good enough. If we got 60% of people to wear a mask that's only 60% effective, which a folded bandana would be, not everyone needs an N95, we could limit the spread of this disease in a way that would really protect our state and our citizens and lives. Just personally, I was at the post office earlier in the week and everyone but one person wore a mask. I happened to have extra masks in my car, so I offered that gentleman a mask. He was more than willing and gracious to put it on. On the other hand, at the grocery store, less than 50% of the people that were shopping had masks on. And what's concerning about that is some of these places are essential businesses. And so our most vulnerable population can't help but go to a grocery store, for the most part. Some of them can afford delivery and whatnot. But it really is our leaders in the community that can put down a mandate that everyone hopefully would follow. And even if everyone didn't follow it, even if we don't want to make that mandate punitive, having that mandate would get us a little bit of a boost and get us over that 60% threshold where we would start to mitigate the impact of this disease. And so I think it's super important that as leaders, we make even the difficult decisions of mandating a mask for everyone, not just employees, but everyone. Thank you for hearing me out.
Great. Thank you, Dr. Childs. Do we have Dr. Helen Adams on the line?
Hi, yeah, my name is Helen Adams. I am an emergency medicine physician at Providence in Anchorage, Alaska. I'm also a graduate of the WAMI program, and I've lived here my whole life. Thank you for the opportunity to speak, and thank you to Dr. Child and Dr. Ritter, who I'd like to just first off say that I completely agree with their sentiments. I think that rather than just reiterating changes in data and new studies, I think the other thing that we as physicians and public servants must acknowledge is that this community needs consensus from its leaders, and kind of what Dr. Child was saying, in addition to a mask mandate, which would reduce our R value, reduce the likelihood of exponential growth of the virus, we need to have a public acknowledgement of the PR problem that exists surrounding masks. Alaskans are an incredible group of people. They take their personal liberties very seriously, and due to mixed messages that have been present regarding mask usage for months from different international and United States government agencies, we need to develop a consensus. We need to say, hey, data has changed. Data now shows that this is incredibly effective. We need to say that we don't need perfection. I completely agree with Dr. Child is saying. We need a mandate that we can support and that the Alaskans can feel safe and supported in doing. I think the best way to accomplish this, and I ask of the legislature, would be to acknowledge that there has been confusion, to disseminate new data, and to create a really concise guideline on where masks should be used, by whom, and by when we would, and criteria for when we would lift this, because I think that that's really important for Alaskans to understand as well. So that's my request.
Thank you, Dr. Adams. Sorry, just taking a note. I can't talk and write at the same time, so I apologize for the pause there. I would ask Representatives Fields and Tarr if either of you'd like to say something, and then I'm going to turn the floor after that over to the Health Department if they have any additional information or responses for us. Thanks.
Sure. Thanks, Ms. Valtel. This is. Oh, go ahead, Karen.
Oh, sorry. I was wondering if that would happen. This is Representative Tarr, and I was just going to add, we have a House Health and Social Service Committee meeting coming up next week with folks from the Department of Health and Social Services as an update, and I think it'll be an opportunity for us to get into this topic, and it would be great if we could get the executive order kind of administrative action, because unfortunately the legislature's not convened at this time, and so it'd be difficult to do something that was legislative action in the sense of passing a policy or something. But I think, myself, Rep. Fields, will speak to that. We in public are wearing masks. I have been trying to include information in every electronic newsletter. Perhaps that's something that we could ask of you to do some outreach to our colleagues, or if that doesn't seem appropriate, maybe Rep. Fields and I and some others could do outreach to our colleagues and say, hey, are you sending out a newsletter? Can you put this in there? Please help us get the correct information out there. And I've just seen, for example, on Facebook, a bunch the U.S. Surgeon General, unfortunately, about 3 days before the CDC changed their position on wearing masks, there's some video of him saying not to wear a mask, and that has circulated very widely. And so I totally agree with the need to, sort of benchmark this new information, new data, new understanding to get past that. And then if we could be helpful, I guess, in reaching out to our colleagues, I think that's one thing we could do and ask them. But I don't know, in terms of achieving a policy, I think we have to look to executive action on the part of the governor at this time. Thank you.
Thank you, Representative Tar. Representative Guido?
Thanks, Ms. Dalteld. Zach Fields, I represent downtown Anchorage in the state house. And in the capacity, I co-chair the State Affairs Committee. We recently held a joint hearing with the Health and Social Services Committee, at which we heard overwhelming support for a face covering mandate, both from frontline employees in Anchorage and also from healthcare providers in the state, including folks who help lead the Association of ER Doctors. I should note that hearing shortly followed the Assembly's previous discussion of the face covering mandate. And in retrospect, I'm sorry we didn't have that hearing sooner, so some of that hearing could have been something that y'all considered. I want to note that when we talked about a face covering mandate at that hearing, we were talking about a face covering mandate for all indoor public spaces for both customers and employees. In addition to having that hearing and hearing testimony from frontline employees and medical professionals, a group of legislators wrote to the governor and urged him to issue a face covering mandate. Many other states and localities around the country have done that. Other countries have ubiquitous face mask usage in some cases because of public health mandate. Unfortunately, and I'm sure you saw that over 160 healthcare leaders from Alaska urged the governor to issue a face covering mandate. Unfortunately, at this time, it doesn't appear likely the governor's going to do that. I don't know why, but I think the question is not so much why is the governor not doing it, so much as are there actions we can take here in Anchorage, both to protect ourselves, to protect our neighbors, to support business operations? Because as we've seen in other states, when we don't have policies like a face covering mandate, it increases the likelihood that the state could have to, or a locality could have to return to draconian lockdowns that are very bad for business. And I would certainly think it's in our interest not only to save lives, but to keep businesses open. I think it's important to note that, there's this misconception out there that, if you're young and you're healthy, then you don't have to worry about it. And in the public, there's a misconception where, if I'm young and healthy, I don't have to wear a face covering. One of the values of a public health mandate around face covering is it helps communicate that wearing a face covering is not about helping yourself, it's actually about protecting your neighbor. And I want to reference the experience in Sweden, which has the least restrictive policies of any Northern European country, and has had fatality rates that are orders of magnitude higher than its neighbors. And contrary to what some folks in the Swedish government thought would happen, a lot of those fatalities have actually occurred among the elderly. And I think that just shows that when you have widespread community transmission of COVID-19, even while you might hope, it's only going to be younger people who are less likely to die, actually widespread community transmission inevitably is going to reach into our elder care facilities. And I'm very concerned that as we have these expanding rates in Anchorage and Alaska, COVID is going to get into the Pioneer Home or Prestige Care, some of our other long-term care facilities. So I think we have to recognize that, even as an individual younger person, you're less worried. By preventing transmission, we're actually protecting our elders as well. And as Dr. Andy Ellsberg noted in that hearing that we held in the House, he's seen patients who are very young, who have severe COVID infection, and we've seen around the world how that can have lifelong consequences. And there have been deaths of young people from COVID. So in closing, a face mask mandate is pro-business. It's obviously pro-public health. The governor should be issuing one. Legislators and healthcare experts have urged him to. If he's not going to, then I think it's really important for the municipality to do everything in its power to help keep people safe, not just because we can protect our neighbors, help keep our local businesses open, but because so many people transit through Anchorage that in doing the right thing in here in Anchorage, we're actually helping protect public health statewide. Thanks.
Thank you, Representative.
And Assemblywoman Zeltov, one quick thing could I add in? If we could get a reaction, if we don't get any response from the governor do you as healthcare providers think there'd be any value in, you know, legislators, say, doing a press conference or something? I was just trying to think if there's another option for us to like raise the profile of the issue, and if you think something like that would be helpful, please let us know.
This is Helen Adams. I think that would be very helpful. I think that any sort of consensus amongst leaders coming out and raising awareness about this issue would be helpful. And I really, I love Dr. Field's sentiments about what we as a municipality can do to be leaders in the state, and that Anchorage being such a hub of travel. I think that if that is something that there's interest in, it should absolutely happen.
This is Dr. Child again. Certainly, I think a press conference and unanimous consent, or even if we can't get unanimous consent, majority can communicate good information. However, I think we're well past COVID fatigue for the majority of people, and many of the press conferences by local municipality leaders or even the governor aren't getting the widespread coverage it had before. So I really feel that the Assembly passing a mandate is about the only action that we can do to save lives, instead of waiting for an executive to do something that they may or may not do. And I'm concerned with some of the discussion about maybe this being brought up next week at a different conference, because every day that we don't do this for a disease that is exponential in its growth, as has been evidenced in many different municipalities around the world, every day we are risking an exponential growth that we might be entering. And so,
Crap.
Can you please?
I'm sorry?
Can you please mute your phone if you're not the speaker? Go ahead, Dr. Childs.
I'm not sure what that was, but that was about my point, that I think we need to move and move quickly, because this is deadly, and our leaders on the Assembly are making a decision about whether or not their neighbors die.
Thank you, Dr. Childs. I'd like to turn it over to the health department if they have anything they'd like to share with us. Ms. Pineda, Dr.
Yep, this is Natasha Pineda, Confused. Can I confirm before I start that Dr. Tom Hennessy is also on the line?
I am here, Natasha.
Wonderful, thank you. And then Dr. Chandler, are you on the line? I think you are, but confirming.
I'm on as well.
So I just wanted to give you some basic information that I think you already have, but then also ask Dr. Chandler to share his thoughts, and then Dr. Hennessy has been working with us through the EOC on doing different surveys, research, and has some observations that they have collected regarding mask wearing and also attitudes towards mandates and things like that. So I'd like him to be able to share that with you, but I think all of you are aware that the CDC continues to support and promote the use of face coverings, masks, whatever you prefer to call it, to help prevent and slow the spread of COVID-19, and that the primary reason that they didn't promote it widely at the beginning was related to supply for providers, which were critical to have, which has caused a confusion, certainly amongst the people that live here in the United States. In addition to supporting recommended use of face masks and coverings for the population, Dr. Chandler and I have been working on some language to share with the mayor regarding our position on it. And the EOC has recently approved a contract for communications efforts to go forward, and a large portion of that communications effort would be focused on helping people understand or correcting the miscommunication or confusion about the benefits of the face coverings and why we use them. So that is forthcoming. I don't have any kind of preview of what that's going to look like, but I did want to let you know that there is an investment in that communications effort. It'll be led by Shannon Kuhn, who will be working closely with UAA, who has been collecting data so that we can use that information to help target our messages to the community. So with that, I'll just turn it over to Dr. Chandler or Dr. Hennessy. Either one of you want to go?
Can I say something?
we're going to go ahead and leave it with the health department right now. If we get to the end and we have time, there'll be an opportunity for audience participation.
So basically, the people that you guys are forcing this on don't have a voice, is what you're saying.
Thank you, ma'am. I don't know who is speaking, but right now we are in the middle of a work session where various presenters are providing their point of view. We are.
But it's based on facts, not just points of view. Like, I live in this community and I live in this state, and I'm pregnant and I'm high-risk pregnancy, and I feel like I'm being taken advantage of and my rights are being violated. There have been viruses, thousands of viruses out long before COVID, and nobody did anything about that. It was all about community immunity. And all of a sudden, this is a big, huge problem.
Thank you, ma'am. Like I said, we're not really doing public testimony at this point, but I appreciate you sharing your perspective. I think next we're hearing from Dr. Chandler.
Good day.
This is a big deal. They want to make mask wearing mandate in the Anchor area.
So I would ask if you are not speaking, if you could please put yourself on mute. Thank you. Go ahead, Dr. Chandler.
But I appreciate all the medical people who've spoken so eloquently. I think we at the health department also agree that wearing masks in indoor public indoor places can be very helpful in reducing the risk of becoming infected or of transmitting the infection to other people who may have unrecognized conditions that put them at high risk from the disease.
Tom, did you want to share? Dr. Hennessy, excuse me.
Sure. This is Tom Hennessy. I'm a medical doctor and infectious disease epidemiologist. I currently work with the University of Alaska, College of Health. Prior to that, I worked for 25 years with the Centers for Disease Control and Prevention as an infectious disease epidemiologist. So I thought it might be helpful just to summarize a little bit what the CDC recommendations are. Their recommendations are to use cloth face coverings in public settings where social distancing measures are difficult to maintain, and they specifically designate groceries and pharmacies, and especially in communities where significant community spread is occurring, and I think Anchorage would certainly qualify in that regard. And the rationale behind this is aerosol spread of the infection does occur, especially in settings of indoor air, where those aerosol particles do not dissipate very easily, and they're generated through speaking, coughing, or sneezing. So basically any exhalation will cause these aerosols to get into the air. And we know that, importantly, about 1/3 of people who are infected with COVID are asymptomatic, and so they may not think to put on a mask if they don't have symptoms yet, still could be spreading aerosol particles in their just daily course of action. So I think it was that rationale, the aerosol transmission, and the fact that some people are asymptomatic, that led CDC to come up with this recommendation. It's important, I think, to recognize there's some people who cannot wear a mask and shouldn't wear a mask. Children less than age 2 shouldn't be put in a mask. And there are people in our community who have trouble breathing with a mask on and are either from a medical condition or from other conditions, and wearing a mask for them is going to be difficult. And acknowledging that and recognizing that in any kind of action or communication that's taken place is important, so that people aren't shamed, that people aren't put down or misunderstood for their if they're not wearing a mask.
Or reported by somebody.
Excuse me. Some of the other healthcare providers that have earlier spoken, I think, raised an important point about the need for education. There has been some confusion about the messaging early on. It's been acknowledged CDC and the Public Health Service did not have a recommendation for masking.
and there was a concern about saving respirators and surgical masks for healthcare professionals. That's still a concern. Those are in short supply. And so the clarification about this recommendation is for cloth face coverings, not surgical masks or N95s. And so there has been confusion about what a mask represents, when to use it, what its purpose is for, under what settings is it helpful. And I think we could do a lot more to educate the public and avoid some of the concerns that we've heard from people, which are mainly based on lack of information, I think. So I agree with the earlier comments from Dr. Child, I think it was, who recommended a full-out education campaign. And I know that Tasha and the health department are engaged in a communication strategy around that, as is the state of Alaska. And that's absolutely critical to have something like that rolled out in advance. One of the things we have learned in some surveys that we've done through the municipality of Anchorage is that in a telephonic survey of 1,000 persons in Anchorage, about 65% of them reported using masks, and this was in mid-May, using masks when they went out in public. And we've done 2 follow-up surveys with subsets of those people, and about 70% of people are reporting using masks. So we already, I think, have a broad community consensus that there's some value to this, and we can build on that through improved education and recognizing that some people are going to have challenges wearing masks. And I think we need to just be more effective in communicating the health benefits to the community overall about the use of cloth face coverings. So those are my comments. Thanks very much.
Thank you. So Ms. Ollisel, can you do me a favor and run down the rest of the speakers so I can get a sense of who's left?
Those were the speakers.
That was it? Okay, fantastic. So we're going to go ahead and turn it over to do a little bit of audience participation. Normally we don't do that at work sessions, but I get a sense that this is one where some members of the public are on the line and would wish to do so. And then after that, if there's any wrap-up comments, I will turn it over to Mr. Dunbar and Ms. Alatel. So members of the public are going to have 2 minutes to speak and share your thoughts. So would anyone like to speak?
I would.
Yeah, if you can go ahead and introduce yourself, please.
My name is Linda Kellen Beagle, and I am here representing a group that I started called Alaska Let's Make Masks Mandatory. I started out with initially with 40 people, and 7 days later we now have over 600. Within the group, I've invited all of you on the assembly who I am friends with, and those I'm not friends with. I'm under Linda Suzanne Kellen in Facebook, so you can request to be my friend. And then I can put you in the group. But I think that with all of the information we've gathered within the group and the people that are in the group, I think there's I don't see a way not to have some kind of mandatory masking, because Alaskans are just not doing it on their own. And like many people, I am severely high risk. I only have 25% heart function left, and I'd like to keep it. So I very strongly agree with the doctor who talked about the businesses like grocery and pharmacy that cater to people who have to go in if they don't have anybody else to go in for them, that there be a mandate for masks in those facilities. Other than that, I personally think that San Francisco had the best idea. They just mandated masks anytime you're outside your home, and just left it at that. And I understand they're ticketing people that they see. So that basically leaves it up to the private businesses and all that. If they're inside there, if they don't want to deal with it, they don't have to. But people just have to realize if they don't have a mask on, then they have a chance of being ticketed. That's just my way of making it easy. It'd be easy on you guys that way. But anyway, I'll let someone else speak, and thank you.
Thank you for participating. I think we probably have room for 2, maybe 3 more people. Would anyone else like to speak? Anyone at
I would
all?
like to say something. Hello?
And if you are not speaking, if you could please put yourself on mute, that would be helpful because we're getting a lot of feedback on our end. Would anyone else like to speak?
Hello,
Sure.
I would like to say something.
Sure. Ma'am, if you can go ahead and introduce yourself, and then sir, I will let you go after.
Okay.
Hello, my name is Janelle Recusado.
Could you speak up a little bit, please?
Oh, my name is Janelle Recusado. I'm a community member in Anchorage, Alaska. I just wanted to point out that making masks mandatory is a violation of our rights. With one person in every 60,962 people are dying from this is not enough.
Our rights
reason
come with responsibilities.
Can you please let me
Let him
talk?
talk.
If you
Let
are
him talk.
Excuse me, I got this. So if you're not speaking, please mute yourself. If we can't maintain decorum and let one person speak, I'm going to end this meeting. So, ma'am, go ahead.
Yeah, okay, thank you. So one person in every 60,962 persons actually dies from this. There's more people dying from the flu. In 2018, I think there was over 80,000 people that died from the flu according to CDC. So I don't think this virus, with the numbers that we're seeing, I don't think it's enough to make people wear masks everywhere. That's all I wanted to say. Thank you.
Thank you for participating. Sir, go ahead if you can introduce yourself.
Yeah, thanks. My name is Bruce Schulte. I live in South Anchorage. I've heard a lot of the comments for and against. I'm opposed to a public mandate. I understand there are people who are at risk. That's great. There are people who are at risk of many, many ailments. They have the right to protect themselves as they see fit. But I think to impose this kind of measure on the public at large is just too much. I mean, it's been suggested that San Francisco has the right idea, so we should do it. Well, a lot of us live here because we don't want to live in a place like San Francisco. And I really object to the efforts to make us like the lower 48. So I respectfully suggest, I do carry a mask. If I go into a business where that appears to be the standard, I'll do it out of respect for the employees. I am not going to wear a mask in public, and I'm not going to expect that every business do so. As the previous person pointed out, the actual mortality rate is really quite low. It's been overinflated. The numbers have been repeated and duplicated and triplicated over and over. I'm done living in fear, and I really object to government promoting this kind of tactic. It's counterproductive. Thanks for your time.
Thank you for participating. So I'm going to go ahead and use these last 5 minutes for any wrap-up comments from members of the Assembly. If other, I have you down. So if other members of the public wish to email us or reach out to us in other forums, you can do that, and our contact info is on the website. Mr. Peterson.
Thank you, Mr. Chairman. I just have a question. I'm wondering if there is statistics from other jurisdictions that require masks that show that masks are effective in reducing the transmission rates.
Is there someone from the health?
Muted.
Oh.
So this is Dr. Child
Unmuted.
again. Yes, there's evidence that mask wearing and the mandate of masks decreases infection rate for other viruses. There's also emerging evidence for COVID. I think other physicians on the line can also speak to the inaccuracy that was stated by at least the 2 last speakers regarding the number of COVID infections compared to the number of flu deaths and the number of COVID deaths. I think it's important that although everyone has a voice in a democracy, I think it is also important that science be held by the people that actually know how science works and that misinformation gets stamped out. That's my piece.
Where's your proof? Show us.
So this,
My information was based off the CDC website. So unless you don't agree with CDC website.
Sorry, so did you get your question or did you just want to move on?
So what jurisdictions require masks and what are their transmission rates, or how have their transmission rates gone down?
Okay, and just understanding we have a lot of people on the phone, who do you want to answer that?
One of the physicians.
Can you give me one, please?
Natasha, is there any, do you guys have anything from the health department on that?
Can you restate the question?
You have stats from jurisdictions
I believe
that require masks?
I believe the question is, do masks decrease transmission, and do we have evidence? And whether or not flu kills more people than COVID. Those are the two questions that are outstanding for the health department.
Okay.
So Ms. Pineda, is there someone who can answer that from the health department, please?
Hold on, I'm just writing down the question, guys. I believe there is evidence that it does decrease transmission, but I'd have to pull it up to get you the actual hard facts and send that to you. Is that Assembly Member Peterson?
Okay, so is that something that you can please send that to all of the assembly members?
Yeah.
Thank you.
This is Dr. Helen Adams, and there was a very recently published Lancet meta-analysis of 144 observational studies conducted both in community and medical settings regarding mask usage. I just read it this morning, and indeed, there's developing very robust observational data that masks are an effective route to reduce transmission. If the Assembly members would like a copy of that Lancet Journal article, it is available free text on the internet, and I'm also happy to email it.
Thank you. Next I have Ms. Allard.
Hi, thank you. This is Assemblywoman Allard, and I just wanted to say that I do support providing information publicly to those who would like to wear a mask versus those who don't, and maybe some of the precautions they can take to do that, along with the 6 feet of standing apart and hand washing. I don't recall who actually made the comment that we would be responsible for neighbors dying, but that is something I think feeds into fear mongering, and whoever did that and made that comment, it's absolutely appalling to say that to anybody. We did, as the Assembly, voted this down twice, and here we are again discussing it. Now, I do know that we did have quite a few rallies, over thousands of people on separate dates, and this was allowed by our municipality. So at one point, or at a certain point, we have to take responsibility, and we don't need to punish the citizens for something that the mayor approved. Let's see here. I don't know. I believe there was some sort of petition for 160 doctors that signed off on that, but that is actually a small portion of the doctors in the state that is supported. And at a certain point, this is political. And I say that because many of those doctors also, and some on the line here now, signed the recall for Dunleavy. So I just want to make sure that we are all going to be working towards the same goals. But I absolutely no way support mandating for any Alaskans to wear a mask if they don't want to. Thank you, Felix.
Thank you. So I'm going to go ahead and turn it over to Ms. Zalatel and Mr. Dunbar. Sure. Go ahead, Ms. Monday.
Okay. I'm just curious, since our understanding is that the mayor and his purview would issue this as part of an emergency order, or executive order. Which one is it? Emergency order. Why are we holding this? Is the idea that we as the Assembly would do something outside of the mayor's right and power through the emergency declaration, or are we just further trying to encourage him to take action? Like, what is the purpose of this meeting?
Sure. Thank you for the question. It's to, one, encourage the mayor, yes, to take action. And I think we heard today at the press conference maybe the most affirmative statement we've heard.
Yeah.
Second, it was to kind of answer those questions and concerns we heard during the last debate. to hear from the public, hear from experts, and then make recommendations to the mayor. And since this is an ever-evolving situation, it's an ongoing conversation.
So will there be another attempt to formally recommend to the mayor, or is that unclear right now and we're just exploring? I guess I'm kind of wondering, I mean, I voted yes on it, so it's not that I have a problem with it, but I think that Member Allard makes a good point. You know, it's come before us a couple times. Sort of what's the plan? Is it to vote again, let it go?
So it's my opinion, and I won't speak for Member Dunbar, but it's my opinion that as long as masks are shown to be effective and our transmission rates are going up, and it's a tool at our disposal, that I will keep bringing it forward to the body to recommend as a tool for the mayor to use. And we've asked the public for personal responsibility over and over again, and our rates are still going up. And so if we want to have an open economy, which I think a lot of us do, we need to use the tools at our disposal. So I want to keep asking the mayor that, and the best way I know how to do that is, one, to ask him, and I have, but also to bring resolutions so that maybe my colleagues will, you know, the assembly will join in making that ask.
Thank you. That's helpful. It seems like ultimately this isn't really a medical question. It's pretty clear that wearing masks reduces transmission. So it's more a political question, I think, and unfortunately it's become so politicized. And I suspect that's part of his calculus. And so, I don't know, I just wonder how we can support.
I also, you know, think that there's an opportunity to have this discussion, and we've had it somewhat about to what extent the assembly has powers under an emergency declaration as well, and so it may be that we need to have that discussion again in this context. But I would much rather work cooperatively with the administration and the mayor to put this tool at our disposal.
Yeah.
Thanks. Okay, so I'm going to go ahead and ask for any final comments from Mr. Dunbar, and then I'm going to go ahead and close this work session.
No, Mr. Chair, thank you. I just want to thank everyone who spoke, particularly the physicians and the representatives from the state government, and my colleagues for concluding a nice busy afternoon of assembly work. Thank you very much.
Thank you. With that, this
You're
work
not going to
session
be
is
the next
closed.
mayor.